Hi everyone, it's Nurse Yalda from Rejuvenation Clinic. Today I'm going to talk about aging process. I always talk to my patient that there's nothing wrong with aging. It happens to all of us. But my goal is to make this process much easier for you guys. The goal is to look healthy. The goal is to look like yourself. I don't appreciate when people looking fake and they look like someone else. So let's go ahead and talk about aging process. So this book, which I appreciated so much, was given to me by an Allergan company, and this is like a mom and daughter comparison, and it explains what happens from age 26 to 64. So it's a very easy book for us to explain it to our patients that what happens during aging. So when we're young, our face looks like a heart. Everything is on the top. And as we get older, everything becomes upside down. It becomes like an upside down V or inverted triangle because aging happens from top to the bottom, and we know gravity, Mother Nature, takes everything downward. So one of the important things as far as taking care of our face, it's our skin. Our skin is the biggest, our main organ. It protects us. Comparing someone who's 26 to someone who's 64, if you pay attention, younger guys, they have healthier skin. As we get older, especially after age 30, especially women, because of our hormonal changes, because of menopause, premenopause, pregnancy, so much happens to our skin. We lose collagen. We can have brown spot, sun damages, age spot, discoloration, rosacea. So that tells you guys how important it is to take care of our skin. One of the main things we can do is using medical graded products. Medical graded products has a higher ingredients compared to cosmetic products. The simple example I can give you guys is when you go to pharmacy and you buy Tylenol, or you go to your primary care physician and he gives you Tylenol 3. Both are Tylenol, but of course Tylenol 3 will have a higher ingredients. With medical graded products, which you buy from a pharmaceutical company, same hyaluronic acid, but higher percentage. So please make sure you stick with your medical graded products. SPF, you must use it every day. UVA, UVB is always out there. So the goal is to protect your skin. I always tell my patients, don't forget about your neck. A lot of people, they neglect the neck. The goal is to make sure your face is matching your neck. Of course, your hands are super important, but still don't forget your neck. After your products, my main concentration will be taking care of the first layer of your skin. That will be your epidermis. Epidermis is your first layer that has 7 layers on its own. If you compare babies, they have rosy cheeks. Their skin looks so beautiful. And then when you look at the older folks, their skin is dull. Why? Because as we get older, our skin cell turnover slows down. So our skin doesn't shed. So we have to make sure we do that beautiful facial. We get rid of the dead skin, dead cell. Chemical peel helps you to get rid of the dead skin, dead cells. It also helps to kill the bacteria. It penetrates nicely to that epidermis to make sure your pores are clean, especially for patients who are prone to acne. So simple reminder how important your skin is. The second one would be our fat pads. As we get older, our fat pads, they descend and they deflate. So therefore, if this beautiful fat pad, which was sitting here, now is shifting downwards. So the goal is to use some dermal filler to 1, replace the volume loss, 2, to camouflage, to make your face more like seamless, healthier, having contour, beautiful cheekbones, jawline. So this is where I encourage my patient, we can use a little bit of a filler, which is made of hyaluronic acid, is exactly what your body has. So easy. All right, next one. We're going to talk about muscles. Angry lines, forehead, crow's feet, frown lines, all of this. The goal is not to look frozen, but the goal is to look softer. The sooner the better, because when you relax the muscles is going to be moving less. Therefore, you're going to have less line, less wrinkles. There are patients that they just have very strong muscles. And when they're talking, they must be the nicest people, but because their muscles are so strong, it gives them a very rough look. Think of emojis. I always use emoji as example. The happy emoji, everything is upward. And the anger emoji, everything is very tense. So what Botox does, it will just give you more like a softer face, everything upward, not much movement. Don't forget, a lot of people pay patient on the upper face. It's so important to make sure we focus on the lower face as well. By freezing the upper face, your lower face is going to compensate. What does that mean? The muscles become stronger. So it's so important. Sometimes we have to treat our platysma band, our chin, our DAO, the frown smiley, no good. All right, so the next one, the last one, bone. All right, so guys, this is Thomas, but we decided to call him Jonathan. I don't know why. Our bone is the foundation of our face. This is like the foundation of your house. After 30 years, the foundation is going to be affected. Especially women, we have smaller bone to begin with. So it's so important to do treatments to maintain this beautiful bone. How? Biostimulator like hyperdiluted radius or Sculptra. It helps you to maintain your collagen when it gets injected to the skin, but also when it gets injected to the close to the bone, it will help your bone to stay stronger. So if you have any question, feel free to watch our YouTube videos, DM me on my Instagram. My goal is to provide you the best service possible, educate my patient as much as I can, and the goal is to stay healthy and young. Thank you for watching.